be here. My name is Robert Malone. I'm a physician and a scientist. I live in the United States. I'm trained in vaccinology and molecular virology and pathology and many other disciplines. I've spent 30 years of my life working on developing vaccines in an ethical, safe way. I've been involved in developing fundamental vaccine technology, including these technologies that give rise to these mRNA vaccines. This happened in the late 1980s when I was still a young man. So I'm very familiar with these vaccines, and I also have a strong commitment over many years to what we call drug repurposing for infectious disease outbreaks. I spent quite a bit of time and effort in developing and identifying repurposed drugs for the virus called Zika. And since the beginning of 2020, beginning actually January 4th, I've been focused on working with a team that is largely affiliated with the U.S. Department of Defense to identify and develop and get clinical testing of repurposed drugs for treating SARS-CoV-2 and the COVID-19 disease. So I've been working very hard on this for quite a while, and I'm very honored to be here with this amazing collection of international scientists and physicians that have come together to share their wisdom and experience with many, many, many thousands of patients in early treatment of this disease. What I've learned, and I've learned over time, and also in listening to this group make various presentations yesterday and today, is how many different drug therapy options we have. So this is a message of hope. In my opinion, we have had a year and a half of fear that we've all been living under, much stress. Many people are driven by this fear. We've had to sequester ourselves. We've had our small businesses damaged. And Italy in particular was at the first wave in the West and suffered greatly. I think all of the world deserves, should respect and appreciate the contributions which the Italian people have made and the Italian physicians. One of the things I've learned in this initial wave and then subsequently, one of the things that I've been very glad to learn about in my travels here and in the meetings beforehand is the international group Hippocrates that has started here in Italy, that has pioneered many of these drug treatment strategies for early intervention and saved many thousands of patients from ever becoming hospitalized. This is similar to various groups in the United States, such as FLCCC, that have also tested and had great success at early intervention with these drugs. So my impression and my belief is that we have hope. We do not need to live under fear. There are agents that are off patent, very inexpensive, and if physicians are allowed to practice medicine, if we're allowed to follow our Hippocratic Oath, if we're allowed to practice our art, as we have learned over many years, and work with our patients to devise treatment strategies that are safe and effective for them, we can turn this